Thank you for the intro and the opportunity to give a talk here. As you mentioned, I am a PhD student in Dr. Andy Chung's lab at the University of Southern California, and I'll be giving a talk on microRNA 145 for atherosclerosis therapy. So cardiovascular diseases are the #1 cause of death worldwide and account for up to 40% of all global deaths each year. And atherosclerosis is the leading cause of cardiovascular diseases. It's characterized by the buildup of plaques in the vessel walls, which can exacerbate blood flow, and upon rupture and the formation of a blood clot, a heart attack or stroke can occur. And due to the nature of the disease, atherosclerosis can progress undiagnosed for many years, and more than half of all heart attacks and strokes occur in otherwise asymptomatic patients. So despite the available treatments, the economic burden of treating CVDs is inevitably increasing, and thus there is a substantial need for better diagnostic and treatment options to improve patient prognosis and reduce the economic burden of CVDs. So current approaches to the detection and treatment of atherosclerosis include the monitoring of several risk factors, such as high blood pressure and cholesterol levels and different inflammatory biomarkers. In addition, physicians will also look for other predispositions such as diabetes, smoking, and lack of physical activity. So likewise, the treatment options revolve around minimizing these risk factors through lifestyle modifications such as dietary changes and weight management. In addition, there are several medications that can be used, such as statins and ezetimibe to lower cholesterol levels, as well as aspirins as an anticoagulant to minimize the risk of heart attacks. And there are more invasive procedures such as angioplasty and surgery that can be used in more serious cases. So notably, statins are the standard of treatment, but not everyone is receptive to statin treatment. And simply reducing cholesterol level can be marginally effective in reducing the risk of cardiac events. For example, this is the ASCVD risk estimator that is used by many physicians to determine the use of statin patients. So for a typical patient that is 56 years old with diabetes, their 10-year ASCVD risk is 25.6%. And with the start of an aggressive statin regimen, this 10-year ASCVD risk only goes down to 19%. Which is arguably still very high. So there's still a need to look into alternative therapies beyond cholesterol levels to combat atherosclerosis. So as an alternative approach to treating atherosclerosis, our lab is looking at addressing the morphological and cellular characteristics of plaques. So atherosclerotic plaques are highly heterogeneous in cell composition, consisting of many different cell types. However, in more recent studies, it has been shown that the majority of up to 70% of the cells in the plaques are actually derived from the healthy and contractile vascular smooth muscle cells. These contractile VSMCs, in response to inflammation, damage, and overexpression of KLF4, can de-differentiate and trans-differentiate into these alternative and more pathogenic phenotypes, such as synthetic SMCs that are characterized by overproliferation and migration. In addition, macrophage-like SMCs that increase cytokines and inflammation in the plaques, as well as foam cells that increase the plaque size and introduce necrosis in the tissue, and osteochondrogenic cells that induce calcification. There is a key regulator for this de-differentiation of the contractile SMCs into these other phenotypes, which is microRNA 145, which directly inhibits KLF4 and can mitigate this de-differentiation of the smooth muscle cells. Yeah. In order to use microRNA 145 as a therapy, there are some key challenges to overcome with nucleic acid delivery. So first and foremost is the administration and circulation method of intravenously injected nucleic acids. So systemic circulation of nucleic acids make them susceptible to rapid clearance by the kidney or the liver, as well as nucleic acids can be phagocytosed and eliminated and degraded through serum nucleases. Furthermore, nucleic acids have trouble reaching their target disease sites and getting uptaken by the cells for effective gene expression modulation due to the opposing charges of the nucleic acids as well as the cellular membranes. So these, I guess, limitations can be overcome with nanoparticle-based delivery systems. And in our lab, we have developed a Micelle nanoparticle specifically to target the vascular smooth muscle cells in the plaque and to deliver the microRNA 145 therapy in the vascular smooth muscle cells. So as previously mentioned by the other talks, we use a functionally peptide amphiphile or an amphiphilic monomer that has a functionalized head group that is hydrophilic and a hydrophobic with conjugated to a hydrophobic tail. These monomers self-assemble into these micellar structures, and miR-145 micelles contain covalently attached microRNA 145, as well as an MCP1 peptide that is designed to bind to a receptor called CCR2, which is overexpressed in the synthetic VSMCs and macrophage-like VSMCs in the plaques. So once bound to the CCR2 receptor in the synthetic VSMCs in the plaques, the miR-145 micelles can be uptaken and escape the endosome to effectively deliver the microRNA into the cytosol of the vascular smooth muscle cells. So we assessed the successful synthesis of the particle and endosomal escape using dynamic light scattering, and found the particles to be about 21 nanometers in diameter, and the zeta potential is slightly positive at 15 MV. In addition, we tested the cleavability of the microRNA cargo with different glutathione concentrations. So at extracellular concentrations of glutathione, which is 10 millimolar, at 4.5 micromolarity, we found that the microRNA cargo is not released from the Micelle nanoparticle, but the intracellular concentrations at 10 millimolar effectively release the microRNA from the micelles. In addition, we tested whether the micelle is effective in protecting the microRNA cargo. Here we incubated the micelle or the free microRNA with nucleases and found that after 24 hours in lane 4, the free microRNA is effectively degraded by the nucleus. However, as you can see in lane 3, microRNA 145 micelles can prevent the nucleases from degrading the microRNA. So overall, this demonstrates that miR-145 is successfully delivered to the cellular cytosols of SMCs and protects the microRNA from early degradation. So we wanted to test the efficacy of the gene regulation and VSMC phenotypic modulation with miR-145 micelles. We obtained diseased and healthy patient arterial tissue from our clinical collaborator, Dr. McGee, at the Keck School of Medicine. We isolated the vascular smooth muscle cells from these tissues and assessed their microRNA 145 levels. And in accordance with a lot of the literature, we find that microRNA 145 is downregulated in diseased tissue compared to healthy. So likewise, we found that in diseased tissue, the atheroprotective or healthy contractile VSMC phenotypic markers are downregulated, such as myocardium, alpha SMA, and calponin, compared to the healthy tissue-derived VSMCs. And in accordance, the atherogenic or synthetic VSMC markers are upregulated in the disease cells. So we treated these cells with our microRNA 145 micelles as well as various control constructs. And we found that the miR-145 micelles can upregulate these atheroprotective markers and downregulate these disease markers, even in the already diseased VSMCs. So this indicates that the miR-145 micelles have some promise in rescuing the healthy VSMC phenotype. So next we looked at the potential of miR-145 micelle therapy in vivo using ApoE knockout murine models of mid-stage atherosclerosis. So these mice were fed a high-fat diet for 14 weeks in which a baseline group were euthanized for comparison. In addition, the other groups continued a high-fat diet as well as received 5 injections of treatment over every 3 days. So analyzing the miR-145 expression level in the aortic tissue, we found that the baseline groups that had 3 weeks fewer of high-fat diet had the highest levels of microRNA 145 expression, followed by the miR-145 Micelle treated mice. Next, looking at the phenotypic markers of the VSMCs once again, we found that baseline levels had the highest level of the atheroprotective and the lowest level of the atherogenic markers. This was followed closely by the miR-145 Micelle treated mice. And looking at the holistic atheroprotective potential of this treatment, we measured the plaque size in the aortic root of the various groups. And the baseline groups, baseline mice had the smallest plaque lesion size in the aortic root, followed by the miR-145 Micelle treated groups. In addition, we performed on-phos analysis of all the lipids in the whole aorta, and we found that miR-145 Micelles reduced the overall number of lesions in the aorta of the mice. And finally, we assessed the safety of the miR-145 Micelles by looking at the histology and morphology of different organs. We found no significant differences between the non-treated groups and the treated groups, and no significant changes in the body weight. And kidney health was assessed with blood urea and nitrogen, as well as creatinine measurements, and there were no significant differences between the various groups. So in conclusion, we find that Micelles can effectively deliver microRNA to the target VSMCs in the aortic tissue, and these microRNA 145 Micelles can promote the healthier contractile VSMC phenotype in the mice. And in doing so, we see there is a significant reduction in the plaque size and the number of lesions in the aorta, which lead to miR-145 Micelles as being a potential powerful strategy to mitigate atherosclerosis. And with that, I would like to thank my PI for helping with the study, as well as Dr. Gregory McGee for helping us obtain the patient samples and tissues, and Dr. Christopher Poon for helping with a lot of the studies in this project and the funding sources.
Thanks, Deborah, for your excellent talk. Really well done. And I've had the opportunity to work on those ApoE knockout mice in the past, and it's incredible how much atherosclerosis they have. And wow, your results are really striking. Excellent work. Well, I have some questions for you, and the audience, please feel free to ask some more other questions. So let me just start with the first one from Nitish. Says, how do you control the formation of micelles to avoid the bilayer structures? Yeah,
I don't think we've actually tested specifically for the bilayers, but we looked at the micelles under transmission electron microscopy, and then found that they aren't really forming any bilayer structures.
Okay, great. Another question from Gordon Francis asks, did you assess other tissues for increased microRNA 145 expression?
We haven't explicitly for this study yet, but right now we're expanding the study and going to look into the liver and the kidneys.
Okay. I have a question kind of related to that. You know, I saw your nice slide on looking at safety. I was just curious, like, how do you decide? Because you mentioned kidney was one that you focused on. Is that standard? I'm just curious, how do you decide what tissues to focus on for safety?
Yeah, so we did biodistribution studies, and we found that most of the nanoparticles are being eliminated through the kidneys.
Okay.
And so, yeah, after like 7 days, nearly all of the particles are flushed out by the kidneys. So we chose the kidneys.
Okay, yeah, that makes sense. Great. Any last questions? Oh, another one. How do you load the microRNA into the micelles?
Yeah, so we don't actually load it into the micelles. They are on the surface, and we just use the maleimide covalent conjugation.
Okay.
Yeah.
Okay, that's great. I think I'll close it for questions for you, Deborah. Thank you so much for talking to us today.